The US makes up about 8% of the world's population, but about 30% of global cases of erectile dysfunction. The risk for erectile dysfunction grows with age, 40% at 40, 50% at 50, 60% at 60, etc. But there is hope. The same low-fat, whole-food plant-based diet that has been proven to stop and reverse heart disease has been shown to help with erectile dysfunction, because both conditions have the same underlying cause, atherosclerosis. Atherosclerosis describes the clogging and crippling of arteries by inflamed oxidized cholesterol. When coronary and brain arteries get clogged up and fail to dilate, this results in insufficient blood flow, causing painful angina pectoris or mini-strokes that are linked to dementia. And these are the milder manifestations of atherosclerosis on the heart and brain. Heart attacks and strokes are often deadly or involve long-term disability and reduced quality of life. Early warning signs. There are two common early warning signs for atherosclerosis: erectile dysfunction and lower back pain. A new erectile dysfunction diagnosis between 40 and 50 years translates to a 50-fold higher risk for a cardiovascular event within the next 10 years. 50-fold! 2/3 of male cardiovascular patients report becoming impotent up to years prior to their cardiovascular event. 80% of patients with lower back pain have clogged spinal arteries. Spinal discs rely on the diffusion of nutrients of close-by blood vessels for nourishment. If these arteries get clogged up, the spinal discs suffer, shrink, and are apt to cause a multitude of trouble and pain. Artery diameter. So, why do we suffer at those locations first? Because of artery diameter. The same amount of plaque in a smaller artery causes a much larger restriction in blood flow than in a larger artery. The diameter of the penile artery is only half as large as the diameter of coronary arteries. Qualitatively, the same is true for the blood vessels supplying spinal discs in our lower back. If you suffer from either erectile dysfunction or lower back pain, it might be a good idea to consult a cardiologist. What about Viagra? Viagra causes the penile artery to dilate temporarily to allow for more blood flow. Clearly, this only treats the symptom. The underlying cause, a clogged artery unable to dilate naturally, does not improve. Viagra does have side effects, and about half of those taking it discontinue Viagra within 2 years. Erectile dysfunction is not fixed by taking some pills. Unfortunately, medication, especially blood pressure medication, often worsens erectile dysfunction as a side effect. When to act? The answer is right now. Atherosclerosis starts in childhood and gets worse over time. In the US, practically every 10-year-old child, about 97%, has fatty streaks in his or her arteries, the first sign of atherosclerosis. In their 20s, 1 in 10 show lower back disc degeneration, and some are already troubled by erectile dysfunction. Even a minor physical impairment caused by atherosclerosis, for example a delayed erection, might set off a vicious cycle of psychological performance anxiety. So if you watch this, it's time to act. What to do? Atherosclerosis is a mostly diet-driven disease. The main drivers of atherosclerosis are trans fats, saturated fats, dietary cholesterol, and refined carbohydrates. Other unhealthy lifestyle factors like smoking, stress, sleep deprivation, a sedentary lifestyle, etc. also contribute to the disease. So which foods should be avoided? The main sources of trans fats are animal products and processed foods. Saturated fats are also found in animal products, but also in vegetable oils and nuts and seeds. Dietary cholesterol is only found in animal products, especially eggs. Refined carbohydrates include sugar-sweetened soft drinks, most baked goods, French fries, potato chips, etc. Whole plant foods. What to eat instead? Whole plant foods. In terms of food groups, that means fruits, vegetables, whole grains and legumes. Nuts and seeds were just listed as foods to avoid. This is because the data we have on the reversal of atherosclerosis currently only supports a low-fat, whole-food plant-based diet. The intake of nuts and seeds should be limited to 1 to 2 tablespoons of ground flax seeds a day. Other overt fat sources like avocados, olives, nuts and other seeds, and of course oil, should be avoided. If this sounds overly restrictive to you, just try it out for a few weeks, and if you don't think it's worth it afterwards, you at least gave it a shot. What to expect? Artery health can improve quickly. With the influx of antioxidants from whole plant foods and the anti-inflammatory effects of foods like berries and whole grains, artery inflammation improves from the moment you make the switch. LDL cholesterol can drop by tens of milligrams of deciliter within a few weeks. Blood vessels open up and improve blood flow. You should be able to notice major improvements in sexual function within the first few weeks. Fortunately, this same diet can bring down high blood pressure. So if you suffer from erectile dysfunction due to blood pressure medication, this is still the way to go. If you want to know more about eating a low-fat, whole-food plant-based diet, check out our other videos on this topic linked in the description below. If you plan to give this a try, let us know by writing "I'm here for a friend" in the comment section. See you next week!